Megan Birnbaum. I'm a student nurse at Concordia University, Wisconsin. I'm going to tell you a little bit about a patient that I had in Surg Clinical. So I had a 68-year-old African-American male. He came into the emergency room on February 2nd with acute confusion after being found in his apartment after a wellness visit. He was alert and orientated ×1. His diagnosis upon admission was altered mental status, hyperkalemia, and renal failure. It was then discovered through laboratory results and discussion that he had not received dialysis treatment for 2 weeks because he did not like the facility. His extensive medical history includes acute renal failure, atherosclerotic peripheral vascular disease, chronic kidney disease, GERD, gout, a history of amputation to the right lower extremity, hyperlipidemia, impaired fasting glucose, proteinuria, renal cyst, ulcer of the lower extremity, and unspecified essential hypertension. He is a full code and did not have any allergies. His vitals upon admission were temperature 97.1, blood pressure 160/79, pulse 76, respirations 20, and pulse ox of 92. My patient's main diagnosis was renal failure. This is the kidney's inability to filter waste and fluid out of the body, resulting in a buildup of those waste and fluids. Signs and symptoms develop very slowly and are not specific to the disease. They do not begin until the later stages, typically the 3rd, 4th, or 5th. The patient will experience symptoms related to the imbalances that are occurring in their bodies, or may not experience any symptoms at all. For example, my patient was experiencing elevated bun and creatinine levels, so he may have had frequent or infrequent urination, itching, extreme fatigue, swelling in the extremities, muscle cramps, trouble sleeping, nausea, or vomiting. Risk factors for renal failure include diabetes, hypertension, smoking, hyperlipidemia, African American descent, and an increased BMI. Treatment for renal failure is to treat the underlying risk factors to slow down the process. You could also get a kidney transplant if you're qualified, as well as dialysis may be needed in the future. The main goal of treatment for patients with renal failure is to prevent further damage by decreasing symptoms, managing risk factors, and attending dialysis if that's necessary. My patient was prescribed the following drugs: amlodipine to decrease blood pressure, atorvastatin to decrease cholesterol, and calcium acetate as a phosphate binder, which could also help to treat his GERD that he has going on. He was also prescribed Procrit to increase his blood counts, and as well as he was prescribed magnesium sulfate and potassium chloride to supplement as needed from electrolyte imbalance. In addition to these, a patient could also need diuretics for fluid overload, iron supplements for possible anemia, antiemetics for GI upset, nausea or vomiting, and then for skin issues that may arise, lotions and loose clothing, as well as no perfumes would be recommended. For lab values, my patient was assessed. His BUN was 146, creatinine 23, glomerular filtration rate was 4 milliliters per minute. So the BUN and creatinine, as well as his creatinine kinase, which was 361, are all very high. And his glomerular filtration rate, which again was 4 milliliters per minute, is extremely low. All those lab values point to the renal failure. His red blood cells, hemoglobin, and hematocrit were also all low. This is because of his lack of dialysis as well as a complication of renal failure. His potassium was 6.3, which is a little bit on the high side, and that has to do with him refusing dialysis for those 2 weeks. Another few labs to check out for patients with renal disease would be cholesterol, calcium, and phosphate. So some secondary issues that may have affected his primary diagnosis was his prediabetes, hypertension, hyperlipidemia, African American descent, and obesity, which are all coincidentally risk factors for renal failure. So I would connect with his care team to discuss with the social worker as well the dialysis programs, to try and make a plan of a few facilities that he could visit and try out to see which one he prefers, because if he is liking his facility, he will have higher compliance rates and less admissions to hospitals in the future for this problem. For education for my patient, I would like to reiterate the importance of his dialysis, because that maintaining of his kidney function is definitely necessary for continuing life past a certain point. I would also like to teach to follow a kidney healthy diet. So this would include cutting out a big chunk of sodium by eating lean protein sources such as chicken, fish, eggs, nuts, beans, and grains. I would also encourage him to choose heart-healthy foods to decrease his high blood pressure, such as fruits, vegetables, low-fat milk, yogurt, and cheese, as well as those lean meats that I had talked about before. Foods with less phosphorus would also be important, which would include fresh fruits and vegetables, breads and pastas, and then corn and rice products. So all of these would be good in aiding him to keep his renal failure under control and to help slow it down maybe a little bit. I researched how certain diets can affect the survival rates of people with chronic kidney disease, and found a study that surveyed many different diets, such as the Mediterranean, Western, moderately restricted low-protein diets, and very low-protein diets supplemented with amino acids. Numerous studies indicated that diet rich in fruits, vegetables, fish, whole grains, fibers, and polyunsaturated fatty acids, but low in saturated fatty acids, is beneficial for the chronic kidney disease patients. It helps to correct proteinuria, lower blood pressure, and increase hemoglobin and hematocrit and red blood cell counts. And therefore, it may not only prolong the dialysis-free period, which is the time that they can go from each dialysis treatment to the next, but it also is proven to increase their survival rates and how long patients with chronic kidney disease can live after their diagnosis. A little side note for this is that the diet should really be closely monitored by a specialist. Thank you for listening, and I hope you learned something beneficial today for either yourself or someone you may know. Thank you.